It's finally time to let you know what's been going on in my life. Um, as a disclaimer, what I'm about to tell you is my personal experience and my understanding of the situation. I am not a medical doctor. This is just my personal experience, and nothing said here should be taken as medical advice. Please seek your own professional opinions and consultations as you see fit. Um, and if you hear anything that doesn't sound right for you, don't delay. If something I say sounds like something that you're going through, go get help now. So, um, for around 2 years, I was having some painful urinary tract infections and blood in my urine. They were literally almost nonstop. For those 2 years, the way I understood it was these symptoms had been attributed to extra sugar in my urine from diabetes and infections and inflammation. And every 2 or 3 months, I was in the doctor's office doing more urinalysis and blood work, and while on a constant stream of antibiotics in the meantime. I kept asking if there was any test if we could do to see what was going on, only to be told that there was no more testing. So in March of 22, after finally asking my doctor, as an informed medical provider, trained person, can you think about what questions you would ask if there was a procedure or something that wasn't showing on my imaging, or a kidney stone stuck, or anything beyond your analysis and blood work that could potentially help? Um, and she looked at me and she said, let's send you to a new urologist. Um, because there had to be something to stop this almost constant feeling of peeing glass and tea-colored urine. And I was eating right. I had lost weight. I was being proactive in my treatment of my diabetes. Um, she said in 2019 that nothing was noted, but let's go ahead and send you to a new urologist. So I asked if I could wait until after vacation, which was happening in a couple of weeks, and she said yes, she thought so since it was an ongoing issue, but to go ahead and make the appointment now. And the earliest consultation appointment was in the beginning of May of 2022. So on May 24th, 2022, I went to the urologist office for a cystoscopy, only to come out being told I have cancer.
So, and another thing you should probably know is if it's weird or medically unusual, it will happen to me. Um, and two, I have been battling kidney stones since the age of 20. She set me up with a appointment with a new urologist, and I was going in to do a cystoscopy. Um, so I went into that procedure thinking that I would be told that I had too much scar tissue and that a kidney stone was up in me. And so my head was that they're just going to tell me it's a kidney stone and it's stuck, and move on, take it out, move on with your life and go on. But as the doctor was looking inside my bladder, he's not seeing anything of concern. He says he's about ready to wrap it up, and then all of a sudden the doctor gets really quiet. He gets very concerned and quickly finishes up and said he needed to go get his colleague while I got dressed. Abruptly. It was just really abruptly. So now when a doctor does a cystoscopy, and for those of you who don't know, a cystoscopy is basically taking a little camera up your urinary area and looking in the inside of your bladder. So when a doctor sees that and then abruptly leaves the room to consult with another doctor, you know it's serious. So the first doctor comes back in and sits me down and says, very seriously, Susan, I need you to listen to me carefully. You have high-grade bladder cancer. The entire top of the dome of your bladder is covered in cancer. And he says, this is not my area of expertise, So I'm passing you along to the doctor I just consulted with. He and the new doctor comes in and he introduces me to the new doctor, and I'm literally in shell shock. I mean, he was very kind and very calm and everything, and tried to answer a couple of questions right away. But he's like, "Let's get, let me get my colleague in here," and because he's he's more trained in this area, and it's very, it's covering the entire top of your dome of your thing, and I'm in such shell shock. My brain just cannot comprehend. I'm saying things like, "No, no, no, you're mistaken. You need to go look again. You can do it again. You must be confused. It's just an infection. I just know there's a kidney stone stuck up there that's causing these UTIs and the tea-colored blood in my urine, and I am just in such shell shock that I can't comprehend what he's saying. I mean, I comprehend it, but it's not fully sinking in, because I went in there for what I assumed was going to be a stuck kidney stone in my own brain. They did never told me that, but that's what I had anticipated, because I had been having kidney stones since I was 20, and scar tissue builds up. So there's got to be a reason for these constant urinary tract infections. Cancer was not on my radar. It was blowing my mind. The second doctor came in, and he just keeps repeating, "Susan, you have high-grade bladder cancer." And I'm like, "Take it out, burn it, cut it, rinse it, repeat it. I don't care. Do it like, shampoo. Do it as much as you want. We got to take care of this." And I didn't think about or comprehend the possibility of no longer having a bladder, or it altering my life long term. I was just like, you take it out, you take it out, you cut it out, you burn it, you get it out of there, and it's done, it's over with. But he's like, the doctor is like, "Susan, it's so big and it's in such a difficult position that I'm not comfortable." This is the second doctor, the third doctor, but the second urologist. "I'm not comfortable beyond the biopsy." And then he proceeds to tell me that due to the positioning of it and the ability to exactly see how deep this cancer goes, and the thin wall lining of the bladder, and various other risk factors that come with surgery, I have a chance of bleeding out during the biopsy and possible death. And he repeats this at least 3 times during our conversation. And I'm like, "What? I did not come in for these results. I came in and fully expected you to tell me that I had a kidney stone stuck. What are you talking about me dying during a biopsy?" I'm there by myself, because my husband asked if I wanted him to come, and I'm like, "No, it's okay. It'll be fine. I'm just going in. All they're going to do is end up telling me that there's a kidney stone stuck, or there's too much scarring and that's causing this, and we'll figure out the next step, and I'll let you know what that is." But I never expected in a million years to be told that I had bladder cancer. So throughout that appointment, I am just in a fog, because this was so not what I was expecting. I'm there by myself, and they were very kind, very, very kind, and tried to help me grasp the situation. But as I'm leaving there, I still do not understand that they can't just take it out and be done with it, and they're just like, "Well, let's just focus on what we have going on right here." And Um, One of the things that was so hard for me, I think, was that he said that he'll take what he can, but he probably won't get it all. So after we do the biopsy, I would need to be referred to another hospital, a larger hospital, because the cancer is just too big. Um, they will probably recommend taking all or part of your bladder. And I'm like, what? My bladder? What are you talking about, them taking my bladder? Because I was envisioning them just taking off like a wart type thing, just inside. Just cut it out, boom, done and over. What are you talking about, them taking my bladder? And what stage am I? What does this mean? I don't understand. Do I need to rush through my bucket list? What are we talking about? And he says he can't tell me exactly at this point because it's so large and they don't know anything until they actually do the biopsy. But I remember pressing him, and I remember pressing for what stage. And I said, I won't hold you to it. And I understand that more information you get, the better informed you'll be. But what stage am I? My brain's broke. I can't grasp and I can't understand what's going on. And he said, well, I hate to tell you this, but you're probably either a stage 2 or stage 3 cancer. So that was really hard. They scheduled a cystectomy surgery for the biopsy, and that was to be 3 weeks later. And as I left the doctor's office, I remember being in such a state of disbelief that my mind could only say, Dear God, help. Dear God, help. Help me. Help me. Help me get home. Dear God. I mean, that's all I couldn't pray. I couldn't think of anything. And to this day, it's still, I can remember being just like, get me home, 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 home. I need to get home. I need to get to my safe space. I need to just get home. Dear God, you got to help me. I just got to get home. And all the way home, I was hearing these doctor's statements on repeat going through my head and trying to process this terrifying information all on my own, because my husband, I had sent him to work and said, no, I don't need you. They're just going to tell me that it's a kidney stone. I mean, they're going to figure it out, and they're going to figure out what the next step is. So with that mentality, I didn't feel I had a need for a driver for the cystoscopy, because they weren't putting me under or anything. So I told my husband to just go to work. Besides, it was just going to be a look in the bladder, no big deal. So all the way home, I was trying to wrap my head around it, and I made it home safely. And my husband got home just a couple of minutes later. I remember I had just literally walked in the door of our home and sat down on the couch, and within a minute, he was at the back door opening from coming home from work. And I told my husband, and for a week we tried to wrap our head around the gravity of the words. And my first reaction was to tell nobody until after we had confirmation. Just, it's nothing until you're told, But then we decided that my children needed to know in case I didn't come home from the biopsy, because he reiterated that the biopsy could kill me. I could bleed to death. I have adult children. They're all close to 30, in their 30s, and so they're not little. Thank goodness they weren't here, because we were like walking zombies. We literally were like walking zombies, just stumbling through it all. And the first day I was just like, no, we aren't going to tell anybody. And my husband's like, whatever you want to do, this is your thing. This is your journey. I'm here with you. I'm here with you. We'll go in debt. We will do whatever it takes. We'll go through your bucket list. Whatever needs to happen, Susan, I'm here for you. I'm not leaving you. You mean everything to me. And I'm with you, whatever you decide. And so I decided the first night, no, we aren't going to tell anybody until we have a confirmation. You know, everything is the same as it was yesterday, only we have this new information and nothing has changed. You know, they don't know anything other than I have cancer and it's on the top of my dome, my thing, you know. But then the more I thought about it was, you know, that evening and the next day was that, what if I go through that biopsy and I don't come home? How are my kids going to feel if I hadn't even prepared them and let them know that I had cancer? I didn't want them to blame my husband for holding on to a secret. He would have done it because that would have been my wishes, but it would have been hard for him. And what if he didn't have he might have needed that support, you know? So Memorial Day weekend was a couple of days later. So I gathered all my children together and explained to them what I had been told and what I had researched in that past week. And it was a surreal experience having them and their significant others all here and telling them that I didn't know what would happen to me, and I only knew that I had cancer and that it was the entire top of the dome of my bladder, and it was so distressing for them that they couldn't even take care. The doctors that I had now wouldn't even be able to take care of me in the long run. There was a lot of tears shed, and it was just hard, really hard. But I mean, the support I got was it was amazing. Thing in my gut said, don't stay local even for my first biopsy cystectomy. But I didn't listen to it. I was so scared and shocked and stuck in fear of the unknown. And don't rock the boat. Just get your answers. What kind of cancer you have? How, you know, is it stage 2? Is it stage 3? Are you going to lose your bladder? Get all those answers, you know, first. I was so stuck in that I stayed local for my first biopsy, even though my doctor had told me that I would, you know, once we got through the biopsy, then I would have to be referred on. I went in thinking kidney stones, and I'll tell you, I wish I had followed my gut, because I am the 1% of the 1%, and having a specialist from the get-go could have saved me 3 months. And we'll get to that. So the second urologist does a biopsy, and I didn't die, obviously, but he did not take all of it by any means. He only took a sliver of it, and the lab looked at it and said, "Whoa, oh my goodness!" They immediately sent it to Mayo Clinic. They didn't even ask my doctor. They just immediately sent it to Mayo Clinic. So this takes even more time. And my husband and I and my family are trying to hold it together. But it's really hard to wait for these results, because I still don't know what kind of bladder cancer I have, what stage I have, how much time I have. Do I need to do my bucket list? What is going on here? I don't know anything. And after a couple of weeks of waiting and they had already sent it on to Mayo, and I'm still waiting for a couple more weeks. And I decided that I'm going to push to get the referral to Indiana University Health, because I know I have some kind of bladder cancer. I know that it can't be done locally, and I get an appointment, and it's another 3 weeks out. I did not get the results from Mayo until the afternoon before my appointment in Indy. And I have literally just found out the afternoon before my appointment in the morning with a urologist oncologist at Indiana University Health, Simon whatever Cancer Treatment Center. We chose them because of the fact that Indiana University created the Indiana pouch, which is a bladder. If you have to have your bladder removed, it is one of the forms of holding your urine, and they actually created that. And with us living nearby, we're within a couple of hours of them. We chose them because if you have that kind of research behind you and that kind of experience, then I felt comfortable with that. I looked into other ones, and I would have been perfectly fine with them, I'm sure, as well, but this was a comfortable spot for me to land on. So the day before my appointment, we get that Mayo that report that was sent to Mayo Clinic, and it says in 2 different places, challenging and highly unusual diagnosis of tumor. Oh, great. Remember how I told you that that if it's weird or wonky or whatever, it's going to happen to me? It does. And the scientists seem to be excited about this, because they thank them in the report. I actually see them thank you for sending it to us. So it's not good when a scientist tells you thank you. This is really great catch, you know. So it's not good, and that afternoon, nobody can tell me still what I have or if I need to finish my bucket list. I don't know what this report means or which type of cancer I have. I don't know, so I don't know what forms of treatment. I finally get a hold of my local urologist. I mean, I had to drive 20 miles away just to go pick up the report because they wouldn't tell me what it was over the phone. I needed that information so that I could give it to my urologist oncologist that I was going to see and meet for the first time the next morning, and they still can't tell me. So when I did get a hold of my local urologist later on, he called me, and he was very kind, but he's like, they don't know, Susan, they don't know what kind of cancer you have. They're not gonna know until they get in there. But I will have to have another cystectomy. So, yeah, that was just unreal. We are headed to Indiana University in Indianapolis, Indiana. They were the ones who designed the Indiana pouch, and we're there for a consult with a third specialist. I have armed myself with a list of 4 pages of questions, single space, almost every medical record that I had since birth, and my siblings' bladder cancer medical records. They gave them to me so that we could figure out what was going on, hopefully. And after a very warm welcome and my brief history, um, I'm told I'm in the 1% of the 1%. So 1 to 2% of bladder cancer patients in the United States have adenocarcinoma. Adenocarcinomas happen in other parts of the body, but it's very rare to have one in your bladder. Mine completely covered the entire dome of my bladder. They, at this point, believe that it was 6 to 8 centimeters, but they can't actually determine if it's invaded my muscles or not. But based on the imaging, they don't believe it has moved to my other organs. So the kicker is the other 1%, 1% of 1%, I found out about my cancer was the doctor believes that I have this thing called urachial, again, I might be saying these words wrong, urachial adenocarcinoma. Basically, this is a rare genetic disorder that happened and started developing before I was even born. I am in my 50s. What the heck, right? So, the urachus is a canal that exists when the fetus is developing before birth. So, it's in my mom. The canal runs from the bladder of the fetus to the belly button, the umbilicus. It drains the urinary bladder out of the fetus, drains the urinary bladder of the fetus. Between the 4th and 5th month of a mother's pregnancy, the canal breaks down. It degenerates into a fibrous band called a ligament. The ligament runs from the belly button to the top of your bladder, and it's called the median umbilical ligament. Sometimes there are tissue remnants of the urachus in adults. About 1/3 of adults actually have these urachial tissue remnants. Usually, it doesn't cause any problem. However, sometimes these remnants can potentially become cancerous or malignant. So urachial cancer will often extend into surrounding structures like the bladder, and they can potentially spread or metastasize to other areas of your body. The exact cause of urachial cancer is not fully understood. They have really no clue. There's not much information out there. I searched all over, and I got very little information. And that is the reason why I'm doing this video. Surgery is the most common treatment option. So that's how I'm the 1% of the 1%. So I have an adenocarcinoma, which only happens in 1 to 2% of people, because adenocarcinomas usually happen in other organs. Mine is happening in my bladder. The other 1% is the fact that I have this urachus remnant that is going from my belly button to the top of my bladder, and it has created cancer. I'm at that doctor's appointment. He has all of my medical records from basically, I brought them with me. I had those people at my local medical facilities pulling records from as far back as I possibly could. And I was armed. I was armed with my list of questions. I had 4 pages of them. And as we're talking, he's answering questions. He's got a great bedside manner, and my fear is still there, but it is lessened so much, because in just that less than an hour conversation, he has told me what he believes is going on, and he sees the imaging. He has imaging from all my, basically any imaging that I had done my entire life. So he's looking back in my records and whatnot, and looking at the imaging. So in 3 weeks, I am scheduled for a a partial bladder removal, to take the dome of my bladder. And that was like the best I mean, if you have to have something like this, that is like the best news that you can get. That they don't have to take your entire bladder away to keep you from dying. And it sucks. It really sucked. But to be told that you aren't losing your life right away, and to be told that there is a cure for this. There is if everything comes out the way that he thinks it's going to, there is a cure for this. When 90% of the people out there who get this, there's no cure. It's a lifetime threat to them. Obviously, he still doesn't have all the answers until he gets in there. But in 3 weeks, I would be having a partial bladder removal. So all of this began in May of 2022, and we are now at August of 2022. And I went to in August of 2022, I went to Indiana University Health Hospital, where my third doctor, the urologist oncologist, did a partial bladder removal to take the dome of my bladder. He took biopsies from 16 of my lymph nodes, and the whole urachus from my belly button to my bladder was removed, to avoid reoccurrence if possible. They basically made a new belly button, and it ended up taking about 10% of my bladder, making my bladder smaller, which that was significantly less than what they had anticipated. They had anticipated it being closer to like 20%, the 20 to 25%, if I remember correctly, that they were anticipating having to take, and they were hoping that that would be enough, and everything. So the additional lab results confirmed another aspect and rare condition of this. I know I'm going to massacre this word. Endosalpingosis, which it's similar to endometriosis. It's just one is on the inside of the tubes and the other is on the outside of the tubes, and it again is a rare condition. It has no cure and affects 1 to 3% of women. After speaking with a gynecologist oncologist after all my surgery and everything was done, she believes that it's fortunate that I had had a partial hysterectomy years ago, because most people are unaware of this problem until it's very advanced, and it's very rare. They don't see it much, but it showed up in my lab results in the cells and stuff like that. So if that's something that you're interested in knowing a little bit more about, again, look it up. There's not much information. You aren't going to find much information, but talk to your doctor about it if you're having some symptoms along that line. So one of the things that I didn't mention earlier that I probably should have is that in April, right before my very first appointment where I was told I had cancer, I got an infection in my belly button. And I was on antibiotics, so, constant on antibiotics, so it took care of itself and never thought anything more about it, and other than the fact it was weird because I had never ever had an infection in my belly button before. But that actually was one of the key things that let my urologist oncologist know that I had to look for the urachal adenocarcinoma, because he said that an infection in the belly button is actually a symptom of it. Oh my gosh, I'm so sorry. Excuse me. The thing is that that was a huge indicator as to having this urachal adenocarcinoma, and for him to know that there was the possibility of them being able to possibly just take part of my bladder opposed to having to remove all of it, and that kind of thing. So what were my symptoms? What caused me to go? Well, I was having constant UTIs multiple days a week. My urine was strong, tea colored. When I had an infection, it felt like I was peeing tiny particles of glass, plus some mild cramping for over a year and a half. We tried everything to get rid of the infection for more than a day or two. I could literally get one, take a round of antibiotics, go in, have my urine tested, it would come back negative, and then 2 days later, I was back in there and they were doing another test on it, and it was showing up that I had another urinary tract infection. Blood in the urine, burning during urination, and in April 2022, I said I had that weird infection in my belly button of all places. Never had one there before, but it went away quickly from the UTI antibiotics. I never would have known that was a symptom without my surgeon telling me that that was actually a symptom of the urachal adenocarcinoma part of it. So, urachal adenocarcinomas are extremely exclusive. They cannot be passed on. Smoking or chemical exposure have nothing to do with this particular type of cancer. There is no rhyme or apparent reason as to why me. It is a total fluke that both my sibling and I have cancer in the same region. It is a total fluke. The surgery recovery was rough, let me tell you. And maybe it's because I'm older, I don't know, but I came home with drains on, a catheter, which they removed a week later. I had to wear pads basically for 2 months and sit and sleep with a bed pad under me for the first month. My bladder was so inflamed from the trauma that surgery does. I was in the bathroom almost every hour or two. When I would spread my legs, even just crossing one leg to the other, I often had accidents. This is one thing to know. The surgeon told me that it will take a year to recover and really know what my bladder limitations are. But as a woman and going through this, that was a very, anybody actually, that was a very rough time to go through emotionally, because I didn't know if I would ever be able to hold urine again. And I get that this is so nothing compared to people who have to have their bladder removed or a larger portion or whatever, but it still is emotional. It still takes a toll on you. Know that it's a little hard to hear, and some people have it a lot worse than me, and that this is not a comparison. This is because I am putting myself out here, and I'm giving this information because of the fact that this is such a rare disease that happened for me. There is not much information out there, and when I was searching, I wanted answers. I wanted there to be somewhere for me to read more about this. I mean, there's plenty of information out there for the 90% of people who have the other type of cancer, but there isn't much information out there for the people like me who have the urachal adenocarcinoma. And because of that, your fear goes up even more. And I want somebody who is struggling with this kind of, to find this kind of information, to be able to hear at least my experience with it. Everybody's experience is going to be different, but this is mine. So right now, I am about 6.5, 7 months out from surgery. I can sleep 5 to 6 hours. I was not sleeping anywhere near that for probably the first 3 months of it. I, that 5 to 6 hours is if I don't drink more than a sip or two of liquid before going to bed, before needing to go to the bathroom. It took a good 3 months to recover the majority of my stamina and not feel like my whole insides were battered and bruised. I still have some sensitivity around my belly button area, but it's not unmanageable at all. It's just every once in a while right now. At first, it was very, very tender. You will not be able to wear pants that even have elastic that is a smidgen too tight, or you will have to wear them lower on you or higher. You won't be able to wear a button on your pants for quite a while, if you have to have your belly button messed with. I have hyper awareness of my bladder. I really struggle mentally to push drinking water, and it's because I'm still healing, and I worry about, I plan my bathroom, visits type thing, as in when I go someplace, I want to know where the bathroom is so that I don't have to worry about if I waited too long to go, or I do find that I do limit my liquids if I'm going out and living my life. I don't do it significantly, but like if I get on a plane, I have to know where the restroom is. I have to know how long I'm going to be driving there. Is there time for me to stop and have a bathroom break if it's longer than, if I'm drinking a lot of liquids, or I'm driving too far or whatever. So there's that aspect of it. I currently have to have well, I just got good news in the last couple of weeks, but when you first get this, then they will bring you back. Like for me, this is my situation. I went back the first week. I went back and had a checkup, and they removed the drains and the catheter from me then. And then I was supposed to have a cystoscopy every 3 months for the first year, and then they would reevaluate. At my 6-month check, so I did the first week, then I did a month, and then I did at 3 months, and then I did it at 6 months. That I went back and did cystoscopies and checking in with my surgeon, and with that, I have to have some tests done before the day, like the day of. I do it in the morning of, and then I have the cystoscopy in the afternoon. It's done in his office. It's not a big deal at all. They just check my urine, and they do a chest scan, chest X-ray, and I think they do something else. I can't remember what the other thing is off the top of my head. Anyways, I was told that because I'm doing so good, I don't have to go back in 3 months. I can go back in 6 months. So that'll be at the year mark that I'll go back and do another cystoscopy and all that testing and everything. So you'll probably be told that you have to have a cystoscopy every 3 months to make sure there is no reoccurrence or development of a different type of bladder cancer. and mine have been clear, so yay. Um, Other things that have happened because of this surgery is that um, inflammation and hormone levels and my diabetes have leveled out so much that we were able to eliminate one of my medications and go down significantly with the others, because my body is not constantly fighting cancer and infection and stress. And all of my blood work and urinalysis is now in the normal range, and it has not been that way in at least 4 to 5 years. Um, my diagnosis is actually PT2PN0, adenocarcinoma urachal remnant, and it makes me the exception to bladder cancer since it's so rare. Um, some people think that I can't relate. You would be completely wrong. I can definitely relate. And because of it being rare is why I felt the need to share my experience with so many others, so that they can recognize symptoms within themselves or symptoms that a loved one is, or someone that they work with has been complaining about, and to encourage others that it's not too late. Don't wait too late. If you have any of the type of symptoms that I have had, go talk to your doctor. In spite of the past, few months being a complete roller coaster of emotion, it was a deeply traumatic fear and experience. It was physical pain beyond what I thought was possible of enduring, and months of years of not knowing or being able to define what was going on with my body. I would never want anyone else to ever have to go through this. So, one thing I want to say is that there's a part of me that is so deeply grateful for having bladder cancer. And it's because I changed. I found strength and support from others that I had never experienced it before. I found my voice, and I learned how to keep pushing and advocating for myself, for my health, for more answers. I learned to maneuver a healthcare system that is overwhelmed, and to think outside of the box for alternative resources and treatments and information. You can find a lot of information on with this organization called BCANN. It's a bladder cancer advocacy network, and they have tons of information. And that was one of the most helpful places that I came across. There's support groups out there, both online and in person. I realized that this is one of the biggest takeaways, is that I realized that while our local specialists are great for the basics standard of care of everybody's needs, but your needs may be served better by going to a bigger facility that has the volume of patients going through it, to have the better technology and research and expertise that can only come from a high volume of people. There's not one clear path to health. You have to use multiple methods together to go towards your healing. I used prayer and meditation and music and nutrition and medication and surgery and counseling and rehab and exercise and light therapy and frequency therapy. I used all of those to some degree. And one thing I learned through this whole thing is how to be perfectly content in living with the unexplained things that faith requires. Without bladder cancer, I wouldn't have solidified that God is God and that He is the creator and author of my life. I mean, I've always had a strong faith, but I 100% believe in the Bible, and the Bible is God's love letter and manual to us. And if God wants to use this affliction, then it's His prerogative, and there is some purpose for someone. I mean, maybe it's just me making this video and getting awareness out there that this is an unusual type of bladder cancer and that I was cured, and that in itself is a miracle. Being 1% of 1% of 1% diagnosis and having so many different obstacles and having so many years of not knowing what was wrong with my body. It's just so hard, and maybe this will push somebody else to ask the extra questions, to be not unkind, but to be a little more firm when asking their doctor for what is the next thing, phrasing your question a different way, because sometimes doctors don't even think outside the box, or think of, if you say, what is it else that we can do beyond what we've already tried? I kept asking for blood work or a test or something like that. Well, I didn't ask for a procedure. What if I'd have gotten that cystoscopy procedure a year earlier? It didn't show up in 2019. Why didn't it show up in 2019? Was it because it's in the dome of the bladder and it's hard to see, and that the colors it wasn't as thick back then? Did they miss it? It's not noted. But I learned how to let others see when I'm struggling. And I did a lot of deep breathing and a lot of praying. And I also learned that sometimes the simplest prayer is just, God, I need you to get me home. Oh God, I don't understand. Sometimes just the word Jesus is enough. So, at any rate, I just want to say this. Thank you so much for watching, for taking the time and following me. So if you haven't followed me, smash that, my face up there in the corner. Follow me. Save this and share it. I'm asking you to please share this, and it's not because I want a lot of likes or anything. It's because I want the message to get out. For more hope and to hear more miracles that have happened in my life, come along for the ride. I'm sure I'll have more. I know I have more. And I just want you to know that I'm praying and rooting for you all. Thanks.